Hello, and welcome to Boomer Health at Home. I'm your host, Maggie Jess, Director of Nursing at AmeriStaff Nursing Services. On today's show, an update on Michigan vaccinations, I have Chief Medical Executive for the state of Michigan, Dr. Natasha Bagdasarian. Hi, Dr. Bagdasarian.
Hi, and thanks for having me on today.
Thank you. Welcome back.
So great to be on your show.
We love having you. So, what is the update with COVID? Still around? What is the environment in Michigan currently?
Well, COVID rates are actually quite stable right now. When we look back at the last few months, we haven't really seen any big surges of COVID. The rates of people reporting positive COVID test results, the rates of COVID patients in the hospital, those have all remained fairly stable and fairly low for the last several months. But that doesn't mean that things are going to remain low throughout this respiratory viral season. And we are expecting numbers to tick up at some point. It could happen closer to January, February, but usually we do see more of these viruses transmit when it's a colder time of year and around the holidays.
Yeah. As people get together with, family, friends, and things like that. Okay. That makes total sense. And can people still get vaccinated?
Absolutely. So, we're really asking people to think about this, not just in terms of COVID or in terms of flu, but we're asking people to think about this in terms of cold and flu season. And there are so many viruses going around right now. And we don't have vaccines for all of them, but we do have vaccines for COVID and influenza. And this is a great time to still get your COVID booster. So, we've got great boosters that target the new subvariants that are circulating right now. And we've also got flu shots. And when we look at the data, this year's flu shot is a pretty good match for the circulating strains. So this is actually a great time to get your COVID booster and your flu shot. And you can, in fact, get them on the same day.
Okay. That was going to be my next question. Can you get them at the same time?
Yep, absolutely. In fact, when I got my COVID shot and my flu shot this season, I got them on the same day in both my arms. And then any symptoms that I had, any fatigue, I got it over with all at once. And so I advise other people to do the same thing.
Okay. Great. So I've been seeing on the news, hearing from a lot of friends that have small children. It's RSV season. So can you explain to me what is RSV?
Yeah, RSV is a virus. It stands for respiratory syncytial virus. And it's something that we have had with us for a very long time. We always see peaks of RSV in the winter. So we typically see peaks of RSV in usually around December, January, sometimes February. And what we saw this year is we had an unusually early RSV season. So we had our peak in November, and it was a severe RSV season. And this is a virus that typically, it can affect anyone, but it typically causes the most severe symptoms for those who are at extremes of age. So either those who are very young, especially those under the age of 1, we're especially concerned about premature infants, very little babies, and then also those who are very old. And this season, what we saw was we had a peak of RSV infections in November, and it was predominantly impacting, again, the littlest ones. We saw a lot of individuals under the age of 4 presenting to urgent cares and emergency rooms and hospitals. And as a result, there was a lot of strain on our pediatric hospital symptoms. So for a while, our pediatric ICUs and hospital beds were really, really full. Now, RSV numbers have started to come down, but those numbers are coming down just as our influenza numbers come up. And we're now starting to see a surge of influenza. We've seen this in other parts of the country, and it is now impacting Michigan. And that's why I think it's really important to think about this as cold and flu season. There are lots of different viruses that like to circulate right now, and we can really use the same measures to protect ourselves overall from all of these viruses.
And what would those measures be?
Well, what we're asking people is to have a plan this cold and flu season. Again, it's not just about COVID, it's not just about flu or RSV, but there are so many viruses that transmit right now. And many of those viruses we don't even test for. We just know that they cause colds and flu-like symptoms. And those viruses are things like adenovirus and parainfluenza virus. So there are lots of them. So if we think about this as just cold and flu season and how do you stay safe, my advice is number one, get vaccines for those viruses that we have vaccines for. So we've got vaccines for COVID-19 and flu. They're really safe and effective. And this is a great time to get your COVID and flu vaccines. So go ahead and book those appointments if you have not had your COVID bivalent booster or your flu shot for this year. Number two, we want to minimize transmission to other people. So, first off, we want you to stay home if you're not feeling well. Now, it might be tempting to go to your family gathering, go to your holiday gathering, even if you're having some mild symptoms, but we really want to stop transmission of all of these viruses. And what could be a mild illness in you could cause a severe illness in someone else. So, stay at home if you are unwell. Use a COVID-19 test, one of those over the counter tests to rule out COVID. But even if your COVID-19 test is negative, we still want you to stay at home. And then other things like covering your coughs and sneezes, using really good hand hygiene, washing your hands, or using alcohol hand sanitizer. Those are all ways we can keep others safe and healthy and even protect ourselves. And just using all those common sense practices that we learned along the pandemic. Now, if you're feeling unwell and you can't completely isolate yourself from people who are, for example, living in your home, you can also wear a mask. So it's a good idea to have a supply of COVID-19 tests and masks this cold and flu season. And lastly, we want people to talk to their healthcare providers, talk to your doctors, and find out if you develop either COVID-19 or influenza, would you qualify for one of the therapeutics we have available? And if you find out ahead of time, that allows you to seek medical care quickly if you develop one of those two illnesses. So that is really what I mean by having a plan this cold and flu season.
That is awesome. I mean, here at Ameristaff, we really try to focus with our patients on preventative medicine, and everything you kind of talked about is kind of helping to prevent any type of a spread of flu, RSV, cold, anything, especially for all these upcoming family gatherings.
We want people to have a safe and healthy holiday season. We want people to be able to gather with their friends and family. This is a time when, I think a lot of folks can feel lonely. The holidays can be hard for a lot of people, and being connected with the people that we love is one of the things that can break up some of this cold winter weather and break up some of that loneliness. And so it's really important that we maintain those connections, but that we do it safely, because I think we can do both. We've got the tools to protect ourselves and have a safe and healthy holiday season.
Okay. And for viewers, if you don't know where to get a flu vaccine or a COVID vaccine, or you need to talk to someone, um, I know, your CVS down the street has it, but calling your medical provider is probably the best advice to give for patients that are at home right now. Is that correct?
So, COVID vaccines and flu vaccines are offered by a lot of clinics and medical centers around the state. But yes, a lot of pharmacies have them. And many pharmacies you can call ahead and schedule an appointment, or even walk in and get your cold and flu vaccines. Or sorry, get your COVID and influenza vaccines administered on the same day. So either talk to your healthcare provider or find a pharmacy nearby. We can send a website link along where you can actually look for sites that offer cold and flu influenza and COVID vaccines in your area. So that's one way to find out where you can go to get those vaccines.
Oh, wonderful. Okay. We will have that at the bottom of our screen later today, all set for the viewers. So thank you, Dr. Bagdasarian. This has been some great information because I think when we stopped talking a little bit, the news, we're focusing on other things. Life kind of goes on. We call this kind of post-pandemic at this point. I know at least that's what I hear, amongst chatting friends and family and things like that. So I just wanted to keep the focus on staying healthy and really preventing any type of spread if we can throughout this flu and cold season. So thank you so much for your time and all of this wonderful knowledge on what people can do to help prevent any type of illness within their homes and their loved ones.
Well, thanks for raising awareness, and everyone stay safe and healthy this holiday season.
Thank you. That concludes our show. If you have any questions or concerns, please call Ameristaff Nursing Services at 248 288 2270. And like Dr. Bagdasarian said, stay safe and healthy.